In 1893, the Toit family rooted themselves in the Ceres Valley on Gromfontein Farm, establishing a farmstead and a company built on wholesome family values. In 1922, the first fruit trees were planted and raised on pure mountain water, which ensures crisp quality. The cool air channeling through the valleys of the Western and Eastern Cape concentrates colors, flavors, and aromas. While our commitment to farming in harmony with nature sees us minimizing waste and responsibly using natural resources. Today, the Toit story is also the story of a dedicated team of up to 8,000 workers we employ during peak season. Together, we produce 250,000 tons of produce a year that we pick, pack, and send to a store near you. So go ahead, pick Toit.
Welcome, everyone. Thank you for joining us for this very special and very exciting topic. I am so glad to be joined by Dr. Jenny Edge today. Welcome, Doctor. Thank you for joining us today. My name is Coach Tash, and and I am I'm joined by Dr. Jenny Edge here, and I just wanted to quickly give you guys a little bit of an intro about Doctor, because I thought it just summarizes so nicely her experiences and why we wanted to talk to her specifically today. So Doctor, you did your undergraduate in London and worked for 5 years in New Zealand, and then moved to South Africa in 1994. And there you joined the Department of Surgery and trained as a general surgeon at University of Stellenbosch and specialized in breast and endocrine surgery. And then I see in 2000, you started a full-time private practice as a surgeon at Christian Barnard Memorial Hospital. I say that with such an American accent. I should say Christian Barnard, the South African way, where you focused on the management of breast complaints. And so for the last 17 years, you worked there in breast services, and you've specifically worked in oncology as well, in the oncology unit. So welcome, Doctor. Thank you for joining us, and thank you for sharing your expertise with us. And for those of you who are joining us, who are watching, this topic is not just something that we should talk about in October. This is something that we should talk about all the time, and it is something that we need to break the stigmas, we need to face the challenges, and we need to work together. And perhaps as not only women, but everybody who's listening with us today, make sure that you spread this message far and wide so that we can help enlighten and educate as many people as possible. So Doctor, let's go straight into it, if you don't mind. What are some of the challenges that we are facing when it comes to breast cancer specifically?
Well, thank you very much for that kind introduction. I'm really sorry I'm not with you in person. For those of you who don't know, my mother was 90, and we've had a weekend of celebrations in England. And my original plan had been to return to South Africa on Thursday, but Boris has completely and utterly messed up my travel plans. And consequently, I had to spend 10 days in Salzburg with my godson, and I've only been with her for a few days, so I'm not flying back on Saturday now. So I'm terribly sorry not to be with you.
No, it's fantastic. The nice thing about this technology, it helps us.
So I'm giving this presentation from sunny England, where it's drizzling outside. It has drizzled most of the time I've been here. I would just like to say that I'm no longer working in private practice and have gone back to Tygerberg, and I'm now head of the breast and endocrine unit in Tygerberg.
Okay, great.
So
thank you.
I'm actually working, in the back in the state system again. And it really has provided many challenges for me. I wonder if we can start sharing my screen, please.
Yes, absolutely.
So this picture is one of my favorite slides. And the reason it's one of my favorite slides is it goes to some way to talking about the challenges that we have that are specific to us in the state institutes in South Africa. We have two systems of healthcare in South Africa, as you know. 80% of resources, doctors, nurses, money is spent on providing care for 20% of the population. And the 20% of the population, namely the private sector, has issues, numbers similar, very similar to the UK, the USA, and other high-income countries. I'm working in the state sector, and it is completely different there. We have very few resources. And at Tygerberg Hospital, we manage over 700 women a year newly diagnosed with breast cancer. So we have a big, busy unit, and there are two of us, two full-time people and one who's part-time. And there's a lot of work, and the breast work is only half of what we do. The other half is the endocrine surgery, which forms about, as I say, about 50% of our work. So we have to be smart. We have to think, what are we going to do? How can this be different? Sorry, I've been talking all weekend at my mother's.
That's all right.
So along came this bomb that we know as COVID at the beginning of 2020. And it provided us with opportunities, and it's provided us with many challenges. In many ways, the problems that normally exist have been exemplified by COVID. But on the other hand, lots of the changes that we wanted to introduce, we've been able to introduce. Why people weren't quite looking, and there was a resistance to change in the public sector in South Africa. There is a resistance to change. It's not considered to be a good thing. So COVID had some positive effects on our clinic as well as negative. Almost overnight, we had to come up with another plan. We had to learn to teaching students online. We had very little IT support in the universities because the IT technicians were very stretched. And the students disappeared from our clinics and are kind of learning clinical medicine sitting in their bedrooms, which is not a great way to learn about clinical medicine. We had to try and reduce the number of people coming to our clinic by 30%. And that went across the board, which meant that the usual biopsy clinic in X-ray stopped, and we had to take those up, and we had to keep our numbers down. And many, many, many people who have a poor income anyway have actually gone to the next level of becoming food insecure. And for the first time working in Tygerberg, we've actually had requests from very proud patients asking us for money for food for their children. So you can imagine that if you have a choice of feeding your child or coming about your breast complaint to the clinic, you're always going to feed your child.
Absolutely.
So it has really provided us with many, many challenges.
Wow.
This is the timeline for patients coming to see us in the public sector. First of all, a patient has to notice a change in their breast and know where that change and when that change requires attention. So as I've just said, if you don't have much money, if you can't actually get to feed your children, then you're going to be very reticent to spend money on, I mean, transport's hugely, hugely, hugely expensive. I'll talk about that in just a minute. But wherever you are, you have to get some form of transport to go to your primary healthcare facility, and you need time off, and you need somebody to look after your child, and you can't have any relatives with you because of COVID. The nurses at the clinics then have to recognize that this is a problem and refer through to a breast clinic, which may be Tygerberg, maybe one of our sister hospitals. We then have to do all the diagnosis on the breast lump. We then have to send somebody for staging investigations to see if it's spread anywhere. We then have to discuss them at the MDT and start treatment. And our goal is that this should be within 60 days. That is huge goal, and 60 days is a long time. If you imagine discovering a mass in your breast and spending 2 months trying to get this lot sorted out before you started treatment, you can imagine how anxious you would be. In reality, the 60 days is often longer than 60 days. I mean, it takes 6 weeks, for example, before we can get a CT scan. The mammogram facilities we can do pretty much on the day, but any pathology takes 3 weeks for us to get back. And we're quite efficient. And we really work hard at keeping our waiting time for a patient with suspected breast cancer down to less than 4 weeks. Sometimes it's down to 2 weeks, but it's hard work to keep it there. So you can imagine that it requires a lot of logistics, a lot of organization. And I think people aren't always aware of that. We do use the phone as much as possible, but patients don't have phones, because it's one of the things that goes. You change your SIM card the whole time and it becomes difficult. Yeah,
that is very tricky. Sure. Wow, that's very interesting. So with that in mind then, doctor, so what are some of the things that we need to be concerned about when we're looking at this?
So one of the first things is the question of a patient picking up change and knowing that there's something different. What advice do we give? In short, if you notice change in one breast, no matter what it is, we can list the different changes. We can talk about changes to the nipple. We can talk about changes to the skin. We can talk about skin puckering. We can talk about a mass. The bottom line is, and the one word you need to remember is change. If you notice change in one breast, there's always a reason for that change. And it takes time sometimes to work out what that reason is, and how far we should go to investigate it depends on many other factors. But if you're going to take home one message from today, if you notice change in one breast, please go and see somebody. If you notice change in two breasts, it's more likely to be due to pregnancy or other things. Obviously, if you're a woman the same age as me, then that's exceedingly unlikely. But there are other reasons for changes in both breasts, and you should go and get it sorted out. But a change in a single breast, no matter how old you are, requires somebody to assess them. Now, the person who's assessing them really should be a qualified nurse. We do not have many doctors in this country, and understanding what normal breast changes are is quite complex, because most people who have a change in their breast won't have breast cancer. And I've just told you some of the logistics that we're faced with. If we see everybody with a painful breast or with non-cancerous changes in their breast, we won't have any room to see those who really need to see us. So we spend a lot of time at this level, at the primary healthcare facility and access level, and those are the kind of endeavours that we're doing in our clinic. So we had some open conversations with patients, and these were 47 patients, and we got the medical students just to talk to them. And we said, what challenges did you have before you before you came to the clinic? And then we took all of these and we put them into different buckets. And the commonest challenge is that of transport. And I mean, South Africa is a nation of storytellers. And one of the stories that we were told was a woman said, in order for me to get to Tygerberg, I have to wake up at 4 o'clock in the morning and leave my 12-year-old daughter to take my 3-year-old daughter to school. Now, how would you feel about that? Leaving your 12-year-old daughter, knowing what's going on in the townships, knowing how vulnerable these girls are, to take the 3-year-old daughter to a place of safety for the day and then get herself to school. And it kind of really rang a bell with me, and I thought, goodness me. And then you have to get on the bus, and it can take 4 hours to come on the HealthNet buses or otherwise to come in. So transport is a major problem. It's a major problem in terms of access to transport and cost of transport. Many patients will be charged up to 800 Rand for a round journey from Hermanus to Worcester. That is a huge amount of money. There are HealthNet buses that are there, but if you have this whole question of leaving your children in order to get a HealthNet bussy, which may be free, and finding the money to pay for a transport, I'm not going to say private transport, but taxi transport to come in, then you're going to try and leave your children safe, and it's somewhere and the Pink Lady group have been fantastic in helping us, providing transport facilities. We now have a system so that a patient can say, we have the patients are graded by their income, and that's done by the hospital, and they will qualify for transport money, and we on every week on the Friday we will reimburse the transport amount for that's based on their postcode. So it's a very transparent system that we have, and we don't necessarily pay them the amount it's cost them to get there, but we do pay them according to the taxi tariffs that are given to us by the Belleville Transport Group. So I would like to say a huge, huge thank you to all of you who've contributed to the Tiger Bay Transport Fund. If you'd like more information on this, then we'll make sure that it's available to you.
Yeah,
and you're welcome to do that. Yeah. So the Transport Fund is it's a fully audited fund. It's through a university account. It involves about 4 or 5 different steps. There is no way that we would use that fund for anything else. Although at the beginning of COVID, we did make a special application that we could actually increase our internet facility within the clinic so that we could phone people, because we didn't have that facility available. And we felt that that was all about access to equitable care and fell under the same umbrella. But since then, since we've used that money to actually help us get going, we actually now use it solely to reimburse patients for transport to the breast clinic. So thank you for that. And that is, as I say, largely a Pink Lady initiative. And we are hugely grateful to you for that.
Wow, fantastic. And just to tie that into what we're doing this week as well. So the Pink Lady Foundation is sponsoring this GIF Ed specifically, but also this week, so that we can raise awareness and to raise awareness to the challenges that we're facing in South Africa specifically. And I think one of the things, Doctor, that you and I talked about offline that is worth mentioning is that a lot of initiatives raise funding, but it's not necessarily applied locally. And this is one that we know is being applied locally, and that's to this transport specifically, which is one of the largest challenges that you were mentioning that you're facing. So thank you to everybody who's contributing, and also continue to find out more in ways that you can help out for this. So continue on, Doctor. I'm sorry I interrupted you there.
No, that's 100% fine. It's very important that you interrupt and that we all know where we are. So we also run 2 courses, which are, can you believe it, the only ones in sub-Saharan Africa to train nurses. So the breast care course is run at Stellenbosch University, and this is a specialized nurses training course that is accredited, that is for registered nurses and professional nurses working in a breast clinic. It's a 6-month course, and we've had very huge challenges when it's come to this. And I'm really, really happy to say that we are just starting the new course. In fact, it started today on the 4th of October. I know this is not the same day as you're having your today is the 4th of October, and we're starting a course today. And we have now, we launched the program 3 years ago, and it's been difficult because it is a face-to-face week, which we couldn't do during COVID at all. It is a short course done by Stellenbosch University for registered nurses working in breast clinics. It teaches them how to put results together. So if you're in a clinic and you have a patient who has these different results, you say, do these results tally with the person who's got the problem? Should we be going further? What other things should happen? How can we keep this person in the system? How do we know this person hasn't come for a CT scan? Because patients drop out of the system and we don't know. And you need somebody there to follow them up, to phone them up, to find out what's happening. And where do we refer this person to? Who do we need to refer? And this is what this is about. So we are delighted to say that I think that this is now really solidified, because we've had a grant from Pakamisa, and Pakamisa, Stellenbosch University, and the Department of Health have all kind of joined together, which is why it's taken 2 years of negotiation and work, have now all joined together in order to move this forward, and actually having that very solid foundation I think is going to make a massive difference. So we will have a residential week in November when all the nurses will come down to our unit, but then they will all go back to their own units, and they will have weekly online meetings, and they have set projects and all these other things to actually try and work through. So we want people to learn about what's happening in their area. There's no point in them coming to Tygerberg Oncology Unit that has specific things. They don't have it in Pretoria. I've had a negative COVID test in the last week or so. I've had endless negative COVID tests in the last week or so. It's nothing to do with that. It's a lot of talking and celebration with my mother. So they will actually come through to us, and then they will go back into their own area. Now, the breast course for nurses is a different course, and this is for nurses working in primary clinics. It's not an accredited course, which means we can move what we're teaching to wherever we are with a group of nurses. And this is a not-for-profit organization, and we are the kind of vehicle through which the alliance between the Department of Health and Pakimisa and everything else. So we're steering that project to go on. Now, we've started a very big project for this, saying, do we make a difference to the nurses that we're training? I'm very proud to say that the breast care book, has actually been translated into East Timorese by the Australian College of Surgeons. And we know that a course like this is now being taught in South America. And we've done a huge amount with one of the American not-for-profit organizations. But we've largely put all of this lot online, which has not been comfortable, because I do think people of 40, women of 40 and 50 need more face-to-face interaction than online, but we've had to do something to keep it going. And we've joined with the Department of Health, and for the time being, we've launched all this on an online platform for the next year or so, and then hopefully we'll be able to go back to teaching face-to-face. And with the other course now having 30 nurses from all around the country, we should be able to do this a lot more easily in different places. So it's been a good year for the breast course for nurses, in the sense that we've had to move to a completely different level. I really like to thank Liska and Elna, who have done so much work on this, because it hasn't been easy. But we've partnered with very big, solid partnerships that make us much more sustainable.
Fantastic. So Doctor, what I'm hearing you saying is that when it comes to breast cancer in South Africa, some of the major challenges that we're facing has to do with the early detection, and because the healthcare system is under such a strain, because there's a few of you that are working really hard and you're under strain, the resources are limited, the CT scans, all of that becomes a challenge. So by minimizing how many people actually come to you, by doing early detection or by having like a pre-screening with a nurse, it will actually put less of a strain on you, so that the transport can be arranged for those who really need to come to you, that can come and see you. So having these healthcare workers out in the field, away from the hospital, will help put less of a strain on you in the base.
Yeah, yes and no. I mean, the thing is that if you pick up breast cancer earlier, the most important thing is that survival is much better. So it's not so much of a less strain on our system. We have to work smart in order to cope with far more patients and be able to do it with the same number of resources. So that's what's happening, is that since we've opened up access, we've gone from seeing 450 patients a year to over 700. And I say managing them, and the reason I use managing them is because many of them are actually dealt with in our peripheral hospitals with lots of communication with us. So we have a Zoom link every single week with all the peripheral hospitals. And COVID has got us to do that, which is the positive side of COVID, because it's given us a huge jolt and made us to where we should be, which is working more efficiently. And so having trained nurses, having trained medical officers, having people who speak the same language, who are kind of understanding what's going on, has made a massive difference, we hope, in getting people through the system. Yeah, so and we can't do that without support of events like this. So thank you so much. But this is what we do with what we have. Yeah.
No, that's fantastic. And I think that that's the biggest thing is there you go. I was going to say it's understanding the resources that are available
Absolutely.
and helping distribute the need across those who really need it.
So, for example, if we take Worcester Hospital, Worcester is a really good hospital, and the others are as well. I mean, you know, I've operated in all these hospitals. We're doing lots of different operations now than we were doing, and consequently, their capacity to operate is a lot more. We run courses on breast surgery at Tygerberg, and there's a nice free and sort of communication between us. And they will say, actually, we think this patient should be done there, or we can do this patient, and we review the patients. So Tygerberg is like the umbrella, and you know, there's not a single week that doesn't go past where I don't speak to people from all of these hospitals, and usually from Carl as well. And we have a big meeting on Friday in which we discuss all the patients, and it really makes a massive difference, I believe, to patients' lives and their you know, their sort of sister and their experience of having breast cancer and coming through our system. So, you know, I mean, that really is a massive, massive thank you to everyone. And we can, you know, I mean, we had a patient who arrived last week and she was very confused in clinic and she wasn't sure why she was with us. Anyway, it took me about 3 hours to find out that she was due for her surgery in Pearl Hospital, but on the HealthNet bussy from Malmesbury, it stopped somewhere and she got on the wrong bus and she ended up in Tygerberg instead of Pearl. But because we speak to Pearl all the time, we managed to get her on a HealthNet bussy back to Pearl and then to have her operation there. So, you know, if you don't have this communication with everyone, you don't help the patients. We also, and I'm not talking about this a lot, but we have, I meet with the head of surgery at breast surgery at Toit on a monthly basis, and we share the same Buller app for referrals. We share the same information, and that makes a massive difference, I think, for our patients as well. So we don't have a them and us approach when it comes to Tygerberg or Toit. We're very similar in our approach and what we can do.
That's amazing.
It's not amazing. It's a matter of just trying to be cognizant of how we can best help a patient, I think.
No, I think it's fantastic. Yeah, just seeing how you guys are changing these women's lives and in the industry as well. It's fantastic.
So this is who we are. We have a Facebook page. I'm not terribly active on Facebook.
So, Doctor, we left off when we were talking about social media and your team. So I think we wanted to continue on with what you guys have coming up and what we can look forward to.
So in the clinic, one of the things that we've done is we've tried to create more of a feel so that we can actually involve people with what we're doing, with the Project Flamingo list, with the other extra activities we're doing. So do follow us on Facebook. There is a Facebook link to Breast and Endocrine Clinic at Tygerberg. We have a website which is rudimentary and not ideal and mainly used for referral purposes. But certainly as the next year or so go, we're hoping to build that up. I'd like to come to the fact that one of the other co-sponsors of today's meeting is Jeff Fitness, and talk about, does exercise have a role and what can you do to minimize your risk of getting breast cancer? The answer is you can never be a low risk person for breast cancer. There are three major risks for getting breast cancer. One is getting older, and there's very little we can do about that. The second is being female, and there's very little we can do about that. And the third is your family history. And if we think of your risk factors as being like the elephant in the room, all the other things are relatively small compared to those three risk factors. What we can do is be aware and go and see somebody if you notice any changes. But there are a few things that we know will impact. Certainly if you're a breast cancer survivor listening to this, what can you do that decreases your risk of getting a breast cancer back? And there's increasing evidence that lifestyle changes do make a difference. We've always been slightly snotty about the idea of lifestyle changes making a difference, but they do. Being fitter helps. And being fitter helps in itself, and also because we know that one of the risk factors for getting a recurrence in breast cancer and probably for getting a primary breast cancer is being overweight. So any dietary modification or any lifestyle modification that results in you losing your weight and actually being a wee bit thinner and having a lower BMI. And it really is associated, a higher BMI really is associated with getting another breast cancer, and probably, as I say, a primary breast cancer as well, then that is good. Exercise is also very good for your brain. And I think that we underestimate that. And with the next pandemic coming, and that of anxiety and psychiatric disorders, I would say it's even more important to make sure that we do take some form of exercise. And modifying drinking is important. So if you, the safe alcohol limit is a huge debate, which I don't really want to get into, but certainly decreasing your alcohol will also help your weight. And there's no doubt that it is related to getting a recurrence of breast cancer. So it is a real privilege to be here with Jeff Fitness. And I do practice what I preach. I do my Zoom class 4 times a week.
Well done.
So I do think it's really important for all of us to pay attention to that. So yeah. In terms of breast self-examination, there will be a slide that will be shown at the end of this interview, which will show you a very standard and basic way to examine your breasts. So there is a little bit of know-how, but I think it's just being aware that none of us are free from a risk of getting breast cancer.
Yeah, absolutely. Yeah, I think you mentioned age, but I don't think we should discredit ourselves if we're younger either. You should start examining at a very young age so that you know what it's supposed to feel like. And when you mentioned earlier in the interview, when you notice a difference in one, that's when you definitely need to make sure that you go and have it checked out. So in conclusion, please make sure that you are aware of your breasts and that you do self-examinations. Make sure that you get it checked out if you find any differences. Make sure that you familiarize yourself with your healthcare providers in your area that can help you. Also, nurses or anyone who is out there, take note of the courses that are available, because that will help with awareness and care and treatment as well. And support the Pink Lady cause, because it helps women that do not have middle-class resources to be able to get the care and treatment as well. And it is absolutely vital that we support women in all walks of life, and to understand the challenges that women are facing. And you mentioned, having to make that decision between taking care of your child or actually going and getting checked out. So having causes that we can support and back that help us to raise awareness, to raise support, is vital, and we need to all get behind that. So Doctor, thank you so much for your time. Thank you for sharing your expertise, your years worth of knowledge, and thank you for your work as well. Thank you for what you're putting in to help all of our mothers, sisters, grandmothers, daughters. And just want to thank you for that. And then anyone, if you have any questions, please feel free to pop them in the comments. This is a pre-recording. Excuse my messages going off here. But we will be going back into the comments, and we'll check it out, and we'll make sure that we point you in the right direction so that you get the resources that you need. And from my side, thank you so very much for joining us. All of you, thank you to Toit for sponsoring this, Pink Lady specifically. And like I need to make sure you all know that you need to log that dot for this Jeff Ed so that you can get your Pink Lady badge at the end of the week. Make sure that you log your workouts as well. And this is from the Jeff side. So please be sure to do that so that you can get your badge. And that's everything from our side today. So thank you for joining us. Thank you, Doctor. And we will talk to you soon. Bye.
Thank you so much. And thank you to all of you for being part of the solution rather than being part of the problem. Okay.
Oh, that's lovely. Thank you.
Bye.